Within the United States, the healthcare system is seemingly more innovative compared to other countries, but is highly unsustainable. Today, Lexi, Norton, Jayden, Raymundo, and Samantha Wang will be discussing the various problems within the United States healthcare system, why these issues matter, and the larger implications of the problems, and finally, a plausible solutions to each of them. A few problems we can see in the healthcare system is structural racism that devalues members of racial and ethnic minority groups, which in turn results in inadequate access to high-quality care, sexism, such as gender bias, classism, and finally, medicalization and overdiagnosing as a cash-in for the institutions. This means that if there are more problems for the patient, there would be more treated wanted, and thus making more money for the institutions. There are also problems with changing the definition of what can be normal. This is seen involving antidepressants and ADHD, which thus cause social harm to people and young adolescents.
Sadly, these problems are present across many different industries in the U.S., but their implications in healthcare are particularly distressing. The current system is unstable and it's very susceptible to erosion over time. This erosion and its current problems affect a majority of the population who need access to healthcare in order to survive and live a healthy life. These problems are exacerbated by private companies who are interested in making money. This also contributes to the wealth and racial differences in the U.S., having different accessibility based off of your income and your race. This healthcare problem also highlights the problems of the government intervention in our private health matters. This graph highlights that the U.S., compared to other high-income countries, is the only one that does not guarantee health coverage and that relies solely on privately, voluntarily health insurance.
A real-life example involving the problems of private-owned insurance, PPO, and a health maintenance organization insurance, HMO, is the story of my grandpa and his experience with the healthcare system. Back when my mom and her family used to live in Guam, they owned an HMO medical insurance. He was having many problems with his heart and couldn't see any specialists outside of the HMO. And if he were allowed to, he was required to receive a referral from their insurance, which as it was, already very difficult. Long story short, he needed to get an angiogram to check to see if there was any blockage in his arteries. The HMO took a very long time to give him a referral to go to the Los Angeles hospital. Luckily, nothing happened to him during that time of waiting. However, despite receiving the referral, the treatment at this medical facility was not the best, due to them lacking the funds for better treatment. If there was not such a stark difference between PPOs and HMOs, many people around the United States would be able to receive the treatment and care without having to expend too much money.
These problems have very large implications on the citizens in the U.S. Politically, we have very little power to change the issues, and that those in power are not listening to our voices. We need to figure out ways to change the system in order to keep the power in the people who are making their health decisions. It also has greed implications present in the over-medicalization of health issues that were not previously required to have medical care, and the prices of prescription medications. These problems have freedom implications. Mainly, if we're in a country that boasts about its freedom and calls themselves free, why are we stuck in a system that is doing us harm? As the system deteriorates, the more people will suffer and die needlessly. Chances are, there's multiple people in the room you're in now who've had problems accessing or affording health care in dire situations. These numbers are present across many high-income countries where the U.S. per 100,000 in the population are higher in avoidable deaths. We are also one of the highest in rates of infant and maternal deaths. In the case of maternal mortality, we are almost double the next lowest high-income country. People are dying, and they don't need to be.
Many other countries with strong healthcare systems have implemented a system that is more beneficial to the citizens. These countries include the United Kingdom and Denmark. In the United Kingdom, citizens have access to free universal health care, which helps everyone to get the care that they deserve. And in Denmark, they have access to not only free health care, but accessible hospitals, and they have easier access to general practitioners without a referral from a doctor or a PPO, from PPO insurance. Additionally, both these countries have lower mortality rates than most, showing the strength of not only the strength of their healthcare systems, but their strength in their care for the elderly, which is something that many countries can work on. Additionally, countries like Germany and Sweden have similar healthcare systems to Denmark and the UK, and during the pandemic, the strength of these systems was really exposed. In terms of a plausible solution, regulating funds and allocating taxpayer money for healthcare is something that many of these countries have done in an effort to strengthen their systems and the access that most people have. Additionally, splitting up responsibilities of each of the regions while following universal rules helps the people to gain a more thorough understanding of the care that many of these people deserve.
In conclusion, through the social lens, the choices we make in terms of our health within our healthcare system are not only decided by us and the patient, but also the environment and institutions.